Hello, everybody. It is Renee, and I am here with Mendy, and I'm broadcasting from sunny Palm Desert. We're moving our offices, and I'm sitting in a hallway right now, broadcasting from the hallway outside our office, our new office. So if you see movers go by, don't worry. Hey, Mendy, how are you? Tell us what's happening back there in Nebraska.
Well, we've got some snow on the ground, so it's super cold, and we're all bundled up by the fireplace and enjoying our, sugar-free s'mores and
I
all of
love
that
it.
stuff. Yeah, thank you for having me. I feel blessed to be back at your broadcast and excited about the topic today.
Yeah, absolutely. So if you are just logging on, would you do us a favor and push first of all, the share button and share this broadcast out to, if you're a clinic, to your Facebook page, group, and if you are logging on as a client, please just share this out to people. It's great information. Mendy is a wealth of knowledge. Could you also, the more likes and hearts that we get, the more that Facebook sends this out organically and gets to travel to people that really need this information. All right, Mendy. So today's subject that Mendy is going to be talking about, and Mendy is a PA, and she runs the Ideal Protein Clinic at West Omaha Wellness in Omaha, Nebraska. And she talked about bioidentical hormones a few weeks back. If you take a look in the video section on our page, you will see that very informative video. And so, Mendy, we are going to be talking today about medical weight loss medications and giving us a lot of information. So, Mendy, tell us about who qualifies for these weight loss medications.
Right. So we're talking about medications that are usually prescribed in your doctor's office, and we have a large clinic here of 10 providers. Are you still there? Sorry.
Oh,
And
yeah.
we see clients that are, typically BMI over 30 to qualify for insurance coverage. And so usually when we're seeing them for a consult for weight loss, we're deciding whether or not they qualify for medications. So you definitely want to consider prescription medication. There's a lot of fake medications over the counter. So definitely check with your primary care provider if you're going to see a provider. Sometimes they might talk about, these medications at hormone appointments or weight loss appointments with your coach. So there's a lot of adjunctive therapies, but it's important to know that you have to qualify and that you want to make it safe for you. So the first thing is that you cannot be pregnant and you cannot be breastfeeding. And we really want to make sure that your blood pressure is safe as well. So always check your blood pressure. Make sure that your coach is checking your blood pressure regularly if you're on these medications, to make sure that we're not causing any cardiac side effects. The second thing that you want to be careful of is that they're not going to interfere with any of your current medications. So always make sure that your coach or that your provider knows that you, are taking your vitamins with Ideal Protein or whatever that might be, because even some of those might interfere with these medications.
So what kind of things should people be looking for that are contraindicative of having a appetite suppressant?
So there's several appetite suppressants on the market, and a lot of these that we're going to talk about today actually are a form of an appetite suppressant in some sort of way. So you want to make sure that if you're on a blood pressure medication, especially a diuretic, that you're very careful that you're not consuming a lot of caffeine. And that's the same case for these medications as well. You also want to make sure that you're taking a multivitamin, because these medications can deplete your vitamins. So your Ideal Protein multivitamin should be sufficient enough. Sometimes I'll actually change around potassium as well. So those are all things to keep in mind. And we'll just kind of go through the medications one by one, and we can kind of talk about contraindications to each. And hopefully, that this can help your clients, or it can help you decide which medication. But it's always important to remember that with these studies that they did with these medications, that they always added diet, and exercise, and some sort of behavioral modification program. So never think that these medications are going to replace anything as far as, allowing you to eat more. A lot of people think, well, I'm going to start this phentermine, and so that's going to allow me to have one cheat meal a week. That's definitely not the case. You definitely need to be very strict with your current regimen. So typically, I don't even start the medication until patients are on a regimented plan and they've developed good eating habits, because we don't want to use these medications as a crutch. So if you're not quite sure if you're ready yet, I always wait at least 2 weeks and I'll help you decide.
So, what exactly is, so let's start with phentermine, and tell us kind of how it works and the things that people should be concerned about or in making this decision.
Yeah, so phentermine is actually a stimulant. The great part about phentermine is that it was probably one of the first medications introduced. And back in the 70s, people took it and it was called fen-phen. And so it actually caused a lot of cardiac side effects. We were blowing out heart valves in these people. So this is something to really be careful with patients. So this is probably one of those medications that you want to make sure that if you have a cardiologist, that you consult with your cardiologist as well. There's a lot of fake phentermine out there as well because it's the cheapest medication. It is readily available off the market as well. So you have to be very careful. And I'm just going to show this bottle to you. And this is a fake bottle. And you can see that it says phentermine, not phentermine, on there. So this is the actual real bottle of phentermine. And so that's the most common dose, 37.5 milligrams. And it usually comes in a capsule. So you want to take this early in the morning. Otherwise, you're going to be awake all night long. It's definitely going to make you feel hyper. And this is the one that you want to be very careful that you don't have a lot of caffeine with the phentermine. Phentermine, like I said, is very cheap. It's very readily available. It's probably the one that patients are on the most, but you want to make sure that you're not on it for a long period of time. Usually I'll give my patients 3 to 6 months on this medication. If it's not working, I would definitely think about switching. Most of the studies are only done on this medication for a very short amount of time, and the manufacturer actually says that in their insert that, it should be 6 months or less, but sadly patients are left on the medication much longer than that.
So tell me, when someone chooses to take this medication, are they using it to try to help them lose faster or more, or what's the reasoning for this?
That's a good question. I think it varies per patient. The average weight loss with all of these medications is really only going to be 5 to 10% per year. So you're looking at, anywhere from 10 to 20 pounds for most patients. So, with our program, with Ideal Protein, everybody knows that patients can lose a lot more than that. So that's something to keep in mind, that they're, an adjunctive therapy, but they're not necessarily something that you should rely on solely.
So basically, if you took this and you weigh 200 pounds, you might lose 10 to 20 pounds, but you could do that in 2 months with just good nutrition and the Ideal Protein plan. So if you have a fair amount of weight to lose, you're not going to want to be on a medication. You're going to want to actually, try to nutritionally change things. So let's move on to orlistat. Tell us about orlistat.
Yeah, so orlistat actually has several names. Alli is the name over the counter, and Xenical is the actual prescription name. So orlistat is the actual generic name. So this medication is actually very safe. It's not the best medication for a patient on a low-fat, low-carb diet because it needs fat to work. And so you take this medication 3 times a day. You take it around meals. And this is actually what it looks like. So that's the box that you want to look for. It's actual capsules. This is the one that you definitely want to take a multivitamin with. And how it works is it actually decreases about 30% of your fat that you consume into your stools. So there's an embarrassing side effect to this, and it works in a couple different ways. It will decrease 30% of your fat, but it also causes some greasy stools. So if you go out and have a cheeseburger and fries, it's going to be pretty embarrassing for you. So it's going to actually show you which meals might be a little bit greasier than you think. So that one works psychologically as well. So definitely be careful with this one. If you're not necessarily on a high, if you're on a very low fat diet, you're probably not going to get good effects with that medication. This one can run.
Okay, so you really need, it's for people that are eating a lot of fat, basically. So if you're using it with the ideal protein protocol, that's not going to give you any help. And again, you're only losing about 5% in 1 year. Like, we don't want to lose 10 pounds. That's like a pound a month or less. Okay, so let's talk about lorcaserin.
Yeah, and you're going to see this one in the news a lot because it just got approved a couple years ago. So this is actually the newest medication, okay? And this one actually works by working on serotonin and dopamine in the brain. It's pretty safe. You can combine it with other depression medications, but again, it's only about 5 to 10% weight loss. So it was touted a lot lately because it's new and because the drug companies are really playing into that. So, if your doctor wants to throw this medication at you, was actually a medication that was very similar, marketed under a different name, that was launched about 17 years ago and then pulled from the market because it was only 5% effective. So think twice about taking this one because it's very expensive and you're probably going to get the least bang for your buck with the Belviq is what that's called.
Okay. All right. So I see that again, you're looking at an average of 7% weight loss over 1 year. So not really getting much, 7 pounds, not really getting much, or about 10 or 12 pounds. Yeah. Okay. So naltrexone, HCI, and bupropion, HCI. I guess I should have practiced these names.
Yeah, no, that's okay. This is what that label looks like. And it has a nice little brain of people on it, actually. So
can you bring it up a little bit?
Yeah. Let's see. Can you see that better?
Oh, there we go. Yeah.
Okay. So that's CONTRAVE. And CONTRAVE, actually, when it came out, I was super excited about it because it came with a free scale and it came with a nurse hotline and free coaches. So that was a really nice option. And it comes with a really handy, week 1, this is how you start the medication, a little chart for patients. So it probably comes with the most comprehensive patient brochure. And it also comes with a savings card. So it says pay no more than $3 a day. So $3 a day, you're looking at it, still $100 a month or more. So what you want to be careful with this medication is it's actually a combination of 2 medications. It's Wellbutrin or bupropion. So you do not want to use this medication if you have a history of seizure disorder. The second medication in here is naltrexone, which actually works on dopamine. We use this medication actually if somebody overdoses on narcotics. It's similar to Narcan, and it can cause constriction of blood vessels. So you want to be really careful with this medication. This medication has probably the poorest tolerability out of all the medications. It has a 30% dropout rate within 1 month. So it's because of that naltrexone. It just makes people feel horrible. So it completely turns off that addiction center in your brain. And so you want to be pretty cautious with this medication, also with depression medication. It's nice that it's an oral tablet. It's nice that it comes with some sort of support system. Again, less than 10% weight loss per year with the medication. And the coverage on it, as far as insurance coverage, is not very good.
Yeah, and when you look at it, side effects are nausea, constipation, headache, dry mouth, vomiting, dizziness, and all of these have side effects. So, really taking a look at, would you rather would you rather be on nutrition and learn how to eat, or take a pill. And you know, I think that's really something you know, we need to touch on. We'll finish this, but let's definitely talk about you know, that how we maintain our weight and how things like this can make us feel like, oh, all we have to do is take a pill. So the next one that we have here is phentermine topiramate.
Yep. So this one is called Qsymia. This is a relatively newer medication as well. This one came out in 2012. It's nice because it has that common phentermine medication, the most common medication in it, but it also has Topamax. So Topamax is actually a mood stabilizer. So you don't want to use this medication if you're on other bipolar medication, like if you're on Tegretol or lithium or Depakote. You have to be pretty careful with this medication. This is actually, though, a combination medication that I use quite often, but I'll typically use them separately. So to have insurance cover this medication is pretty tough. So I'll typically use the phentermine with the Topamax, and the Topamax actually comes in a long-acting formulation called Trokendi. And Trokendi is nice because it's only once a day, and the phentermine's once a day. So it's a very simple regimen. It's probably one of the most effective, actually. This one actually had a 14.4% weight loss, which would mean, yeah, so it, you know, about 29 pounds of weight loss in a person that weighs 200 pounds. So let's see, cholesterol has also been shown to improve on this medication. Side effects, dry mouth, because that phentermine speeds your metabolism, constipation, a pins and needles feeling in the extremities, and you can also feel very dizzy. So if you're going to take Trokendi, it can cause some nausea and dizziness. So I always tell patients to start it on the weekends. So if they are going to drive, you know, that they know how it affects, you know, in their body, so they don't get in an accident.
Right. Wow. Okay, last but not least, we have a liraglutide injection, which is called Saxenda.
Yeah. So this one is actually the most expensive. It's actually $1,300 cash pay a month.
Wow.
So yeah, so this is Saxenda, and you can see the pen there. It's a once a day pen. Okay. And the pen needles are really tiny. They're this big. And you can barely feel them when they go in your body. So incidentally enough, this is actually a medication that's exactly the same as another medication that's been out for a long time. It's a diabetes medication that's a once a day injectable. So this is in a class of medications called SGL1s. And if you're on a keto program, you have to be careful not to take SGL2s. This is not an SGL2, it's SGL1. And what it does is it changes the way that glucagon and insulin are released in the body. So another medication that is actually the exact same medication by the exact same company and much cheaper is this medication here. And so you've probably seen commercials for Victoza. So usually if patients have impaired fasting glucose, I can typically get Victoza approved. You can't go as high. The maximum dose for Victoza is 1.8. The maximum dose for Saxenda is 3. So, you know, sometimes on that larger patient, I might need to switch over to Saxenda. The Saxenda samples and the Victoza samples are readily available. It's nice because it doesn't have to be refrigerated. You give it to yourself in the stomach first thing in the morning, typically. It causes nausea. So you know how that keto flu feeling that patients have at the beginning of their program? They might feel like that all the time on this medicine, but then they typically adapt to it after a couple of weeks. So I do think this medication is promising for those patients who are very addicted to sugar. And we're talking about Victoza and we're talking about Saxenda. So if a patient is really addicted to sugar and they're telling you, I'm hungry all the time, and you can't get that hunger feeling to go away when they're in ketosis, Victoza and Saxenda might be a great option for them. There's also newer once a week combinations out. There is one called B-Sice, and there's one called Trulicity, types of insulin that you can even try. But typically, we want to try and get these patients off of those medications, but the manufacturer does recommend that we possibly consider keeping them on these medications long term if they have some sort of impaired fasting glucose. So I have been able to get some patients off their insulin and onto these medications. So this is probably one of the more exciting realms that has come about lately. Hopefully we have an oral, medication in the future, because I do feel like insulin and glucagon, as we know from Ideal Protein, they play a huge role in weight loss.
Yeah, absolutely. So I think who is the optimal client that would use this, and how long would you put them on one of these medications?
I think that depends. I think you want to make sure that their BMI is over 30 for sure. I see a lot of practitioners placing patients that have, just slightly overweight on these medications because they want to kickstart their diet. I'm guilty of that. I used to be one of those people, but I really feel like you're band-aiding a bigger problem. I really think it's about behavioral therapy. It's about really figuring out what that patient's eating, getting them to keep a food diary. I mean, keeping a food diary actually provides double weight loss, double. So why wouldn't you have a patient just keep a food diary, and maybe they're having 6 to 8 Cokes a day, and you don't have to put them on phentermine and make them feel horrible and have insomnia and dry mouth. So, it's just a matter of taking the time with that patient. And unfortunately, as practitioners, we usually don't have that time. We have a 15-minute visit with the client, and they say, oh, by the way, my friend's on phentermine. I would like a script. Can you give me that? Sure. Why not? So it's just a matter of taking that extra time and saying, let's schedule another visit and really hone in on what's going on.
Yeah, ultimately, in my clinic, I'm not a medical practitioner, so we don't use any of these types of things. But ultimately, we have to figure out how to keep the weight off. So if we're just continuously dieting and dieting and dieting, we know that, in the long run, we are going to just be actually bigger than we once were. So every time we yo-yo diet, we gain a little bit more fat and a little bit more fat because we never gain back that muscle that we lose. Ultimately, using something like this may help you to kind of get going and off of the cravings, but we really want to manage the rest of it with nutrition. Is that right, Mendy?
Absolutely. I mean, if you can connect your client with a health coach, if for some reason Ideal Protein is not working out, definitely make sure that they do have those resources in place. It's really an epidemic, and we have to tackle it one patient at a time. So I'm so thankful for Ideal Protein and for, the knowledge that I've learned, and really helping my patients and having them come in tears and hugging me when they lose weight. So I never had that when I placed patients on medication before, right? But when you give them a program and you give them a tool, you're going to get so much more. So that's the important part.
Yeah, I completely agree. We are on kind of a short time frame today, so we won't be doing any Q&A, but I know there's a bunch of comments, Mendy, that you can respond to afterwards, after the live broadcast. If you are coming on and you're watching this in the replay and you have questions for Mendy, please just write them in the comments section. And of course, hit the like button and the share button. And we hope that this information gives you some real value for making really good decisions. And upcoming in a couple of weeks, Mendy is going to be coming on, and we're going to be talking about different kinds of surgery, weight loss surgeries, and just kind of, again, just like we did today, reviewing all of the different options, talking about the pros, the cons, what makes them valuable to you, what makes them maybe something that you don't want to choose, and it's not right for everybody. So Mendy, before we go, do you have some tips that you want to share with people as they're making these decisions?
Definitely just keep a really open mind when you go in for your physical. You know, make sure that you're going each year. Make sure that you're really tracking your progress as far as your BMI. Know what your BMR is as well. Don't be afraid to ask your doctor and talk about those discussions, because there is some stigma and your doctor is probably not going to bring it up. So, you know, if you're unsure of, you know, if you're a practitioner watching this and you're unsure how to talk to your patient, we have tools and resources. I'm happy to provide to you some open-ended conversations that you can have with your clients. And as a patient, you know, take it to heart. Your practitioner cares about you. They're not just trying to harp on you about your weight. It just really takes that extra special practitioner to bring it up. So, you know, even if you're there for a cold and they say, by the way, you know, your weight's creeping up, try not to take offense to that. They really do care, and they're going that extra mile to keep you healthy. So that means you have a good practitioner.
Yeah, and I think that's a really good point, Mendy, because you know, we can be ultra sensitive. We're already there to get a physical or go to the gynecologist or what have you. So it's already something uncomfortable. We're uncomfortable with our weight, and now we have to step on the scale and see it in the raw. And so, you know, being patient with your medical practitioner and understanding that actually, you know, the government really is wanting health practitioners to help people with the obesity epidemic. So really understanding that when a practitioner approaches you about, you know, that maybe you gained some weight over the year or over several years, that they're doing it really out of the bottom of their heart and kindness, and they see all of these, you know, things come up each week and each day and each year with each client, and they see the overall effects of sugar and diabetes and hypoglycemia and just, you know, on and on with the different medications and different things that people do. And sorry, we lost Mendy. She had some technical difficulties, but no worries. Thank you, Mendy, for coming and joining us. And thank you. Looking forward to next week and talking with Melissa, actually. We are going to be talking about keto diets, and so looking forward to that. So again, thank you guys for showing up. Please, if you're watching this in the replay, share with others. Put your comments in the comments section. Mendy will definitely come back and be responding to everybody. And looking forward to seeing you next week. Bye-bye.